Assalamu alaikum. Another communication scenario, and this is the scenario regarding difficult parents. And you are talking to Mrs. Nusrat, 8 months old Oliver. Oliver admitted yesterday with history of difficulty breathing, mild dehydration. Examination reveals low-grade fever, wheezy chest. He has been treated with nasal oxygen and IV antibiotic. His general condition improved. Today he looks well and active, still wheezing and mildly distressed, but can feed orally. Mrs. Nusrat asks to speak to you as she is angry as Olive not given antibiotic. Speaks to Mrs. Nusrat and address her concern. Hello, good morning. This is Dr. Roxana, one of child and adolescent doctor here. Am I speaking to Mrs. Nusrat, mom of Oliver? Yes. So thank you for coming. And I have made this arrangement so that nobody can disturb us. Before starting our conversation, do you want to accompany anybody to attend this meeting? Okay. Mrs. We can start just like this way. So how can I help you? Or and I understand that you have some concern regarding Oliver's condition. So can you tell me more about it? So if we can tell you that, yes, yesterday we have admitted Oliver, but I think that you are not taking care of Oliver. You are not starting even any antibiotic. Then we can say that Mrs. Nusrat, I can find that we're very much in stress, and it's natural, whatever happened from the last night. Yes, so can you tell me how far you know about Oliver's condition today? Yes, I now I come to know that yes, his condition is better than the previous day. But why not you were starting any antibiotic that night? Yes, I'm telling you that for this reason, for better understanding, I made this diagram, and this is suppose our breathing machine lungs inside our chest, just like an inverted tree. Okay. Yes, and in this tree there is some. This is we call this channel we call bronchioles. Okay, and this is the small tubes. Yes, and this is called alveoli. But you don't go through this very much difficult. But if you go through this, that is infection of this channel, we call bronchiolitis. You ever heard of this? No. Okay, so I'm telling this condition is basically occurs in the children, and it caused by virus. Yeah, are you with me? Yes. So there is the Oliver is presented with low-grade fever and breathing difficulty and had some dehydration, and we suspect that this is bronchiolitis. For this reason, as I have mentioned, it is caused by the virus. So usually there's no need of antibiotic. And found that Oliver is recovered from the condition that he suffered yesterday. Now he's recovering. Are you getting my point? No, yeah, you know that. Mom may shout that you know that one of my friend's daughter was admitted with this type of condition, and after 2 days he was admitted to PICU, and he had a very difficult journey. I'm so sorry about your friend's daughter condition, but I want to say, and I'm getting the point why you are very much worried and telling us to start antibiotic. So, Mrs. Nusrat, this case was probably different case where we start the antibiotics. Suppose he had fever more than 38 degrees, breathing difficulty, not feeding well, and then we will looking very much lethargic. So that time we do some investigation, and at the same time we start antibiotic. But this, in this case, is different. And with this management, he is now doing well. Oliver is now doing well. Do you know about the effect of antibiotic? Can you tell me the side effect of any antibiotic? Because you know every medicine has some side effect. Do you know? Yes. Yes, that is that we will pause and give chance to mom to say something. Yes, you were right. Giving antibiotic has some very much side effect, some side effect, just like may cause nausea, vomiting, and sometimes it is a tummy pain may occur, may sometimes cause diarrhea. Are you getting my point? Okay, and so in this case, when we weigh the benefit over the risk of giving antibiotic, here we find that risk is more than the benefits. For this reason, the thing we are planning to do, so we will keep Oliver in our follow-up and we'll update you. If there is any of the scenario that I have mentioned, that fever is more, feeding difficulty, and he's looking his condition is not growing well, that time we have to start antibiotic, and we will discuss this plan with you. But in this time, starting antibiotic is causing more risks than the benefit. Are you getting me? Do you have any other concern? Um, in this case, mom may be again frustrated. I'm thinking that yesterday, last night, you are not properly take care of Oliver. So you may justify her feeling in this way, that I can see that you're very much, or it's very natural, and I can understand. But however, I want to reassure you that Oliver condition is now improving, and his breathing difficulties now less than the previous. So in this point, as he is doing well, so when we weigh the benefit over the risks, so starting antibiotic, we find that it will cause more risks than the benefit. Do you have any other concern? If you have no other concern, may I summarize today's discussion? So today we have discussed about Oliver's condition. He has been suffering a condition called bronchiolitis, and here, which is caused by virus, and we discussed about the management plan or era regarding Oliver, and I will provide you some leaflet regarding bronchiolitis. So thank you for coming, and I wish Oliver's speedy recovery with a good health. Thank you very much.